Hi everyone, my name is Nicole Taylor, and today I will be doing my leadership conference on bullying. Within this presentation, I might use direct quotes, and these will come from different research materials that I've used to gather my information for this presentation, and the appropriate references will be provided at the end of this video to correlate to the information provided. So we're going to go ahead and jump in. Um, Bullying. We have always or frequently hear the term nurses eating their young or nurses eat their young. And sadly, this is a widely statement that's used either sarcastically or, literally. And sadly, it's not a good thing. Bullying, it's a systematic, progressive, and a pervasive problem. The American Nurses Association identifies it as a repeated, unwanted, harmful action that is intended to humiliate, offend, or cause distress in a recipient, and calling it a very serious problem that threatens patient safety, the RN safety, and just the nursing profession as a whole. So it jeopardizes a lot. A journal article that was read and looked at that was entitled on our own worst enemy, the nurse bullying epidemic. It identifies this problem stemming from all the way back in nursing school through a nurse's career. And that's a lot to deal with. Um, it brings a lot of stress on that victim or victims, and it can lead to really, really negative outcomes like death, nurse suicide. So it's a very, very serious problem that needs to be addressed. It is not, it's, it seemed based on reading that it's something that's not, it's watered down, it's there and it's identified as a problem, but it's not aggressively corrected, so to speak. Um, Now, we know that, as I said, that bullying affects not just the nursing, but patients and just the whole organization as a whole. Some of the negative effects that bullying may result in is that a nurse may leave their first job within a few months to a year just because of what he or she is going through, or it leads to just poor nursing environment. There is no room for growth and for improvement, no room for promotion. It just leads to a very negative and poor nursing environment. And it also increases the risk to patients and can lead to just low patient satisfaction rates, which can reflect in the low HCAP scores, which we all know is a very important aspect in hospitals per se, because that's how majority of them get their funding. Now to just dive in a little bit more with a background of bullying. Um, Again, this is an issue that has been ongoing, and it continues, again, sadly. Um, I have witnessed um, some, and it wasn't direct, it was to another coworker. But at the end of the day, it became very evident that this is real, and it doesn't necessarily have to be a staff nurse to staff nurse. It could be a manager to a staff nurse, a leader to a staff nurse, a patient to a staff nurse to staff nurse. Just as long as it is bullying, it doesn't matter who is the perpetrator and who is the victim. Um, One of the articles that I read kind of broke down the act of bullying or bullying per se into two different categories. So you have overt bullying and covert bullying. Overt bullying is just, in a nutshell, one that's easier to recognize. It's more direct. You can pinpoint it, you can say, hey, that's bullying. So it's easier to recognize, and it could include micromanaging. verbal criticism, name calling, insults, threats. While covert bullying is not that easy to identify, it's more subtle, but it's still obvious. It's still there that it is bullying. So it might not be very obvious, but it's still there. And it's identified as more indirect, more passive aggressive, and it may include rumors, gossips, withholding information, unfair assignments, sabotaging in any way. So these are different categories that bullying may be divided into, but at the end of the day, they both share the fact that they bring negative connotations and lead to negative impact on patient, on the nursing environment, on the whole organization. Now, leaders play a huge role in workplace bullying. Either they can contribute to it or they can help in eradicating this whole culture, this whole nurses eating their young culture that seems to exist. They play a role in reducing bullying that if it's present in the workplace by they could either raise awareness, they can mitigate contributing factors, so kind of like reduce those factors from happening, and they can enforce a strong anti-bullying policy. So it's something that even though there might not be a policy in place right now, it's something that nurses could come together with leadership and they can create a policy, because at the end of the day, all these policies that we have in place right now as we speak in different organizations weren't all there at one point. They had to be formulated because of an issue that was currently standing. And so with this is something that we should fight for, to have policies created, and not just have them created, but for them to be enforced, strictly enforced. It's important to nip that bad habit in the bud, because if not, it can escalate. And as I mentioned, it could lead to very, very negative outcome, sorry, just like death, where a nurse just commits suicide because it just has been overwhelming for him or her and they could not take it anymore. Okay, leadership presents acts in lending a hand to thriving bullying culture. So when leadership does not actively do anything to stop this culture from growing or from happening, then they're basically lending a hand in all of this. So leadership has, or those in leadership, has a very vital role to play in ensuring that the work environment that their fellow nurses are in is a healthy one that's uplifting, one that's built off trust. And that cannot happen if there is a surrounding bullying culture that's present. Now, sometimes too, the type of leadership that a leader might possess or display could also um, foster an environment of bullying. If the leader is very direct, domineering, and leads through fear and intimidation, this can foster the same kind of feeling in staff and could also lead to bullying. However, one way that leadership could correct this is implementing the correct leadership style that would influence that healing environment. And transformation leadership usually aligns with ethic of care. What is ethic of care? Basically, ethic of care, is a moral approach that is characterized by contextual, holistic empathy and is based on caring, strengthening, and maintaining interpersonal relationship. And so when transformational leadership combined with this ethic of care and ethic of justice, it fosters an environment where followers' interests are put above their own. So those nursing staff, their interests are put above the leader's interest, and their influences they influence followers, sorry, to build relationship within the work environment. So again, this is a very, very key thing that leaders need to take account of and to try to fix so that they can eradicate this problem, because it just leads to so many different things that is not productive. And we're all about productivity, about patient's outcome, about patient satisfaction, and even just the wealth and health, the health and the well-being of our nursing staff. Joint Commission identifies the results of this kind of intimidating behavior as one that could lead to med errors, poor patient and staff satisfaction, really bad staff turnover rate, and poor collaborative work environment. So, just all in all, there is no positive outcome per se to having bullying within a workplace environment. Now, to play the devil's advocate, I read from a business journal article that was entitled Workplace Bullying, Not a Manager's Right. And in the latter part of the article, they somewhat put a twist to bullying and played devil's advocate, where they identified it as somewhat of a positive outlook, and they stated that managers might be able to consider bullying to be a rational act aimed at controlling employees, but only in a short-term period. So they identify this as something that can be used as something more like strategic to increase the productivity of their employees over a short period of time. However, they made sure to identify that if this escalates and if this prolongs, it could lead to an unmanageable and stressful situation, or it can become a health related issue for the victim, him or herself. However, it cannot be denied. Again, this is plain devil's advocate. They said it cannot be denied that it is an effective management tool to manipulate the employee and increase his or her productivity and level of motivation. So, again, they're using this more in a business fashion to look at ways they can increase productivity in their employees and just the whole productivity of their organization as a whole. But in general, and this is a problem that needs to be addressed. It's something that is not healthy. It doesn't do a lot of people any good. I mean, I know they try to highlight a little positive outcome of it, but overall, with everything that's read, there are many, many negative connotations to this dilemma more than positive. And so, in the long run, bullying, it could lead to disastrous and expensive outcomes for both employees, the managers, and the organization as a whole. Therefore, workplace bullying, it needs to be condemned. So within the same journal article, even though it plays devil's advocate, it identifies it as a serious problem that needs to be condemned. Well, again, I thank you for listening, and I hope you enjoyed this presentation. It was just a little bit longer than I expected, and I tried to cover as much information. It was a great amount of information I received and during my research, but it's a very, very important topic to look into, and whenever you do get the chance, it's something that's it's it's a well good read to identify and see what has been going on, and what plans are in place and what you possibly maybe can do to contribute to eradicating this problem called bullying. All right, thank you, and you have a great day.